Hi, I'm Jeffrey Seybold, a board-certified orthopedic surgeon working with Twin Cities Orthopedics, and I have subspecialty fellowship training in foot and ankle orthopedic surgery. I'm here today to talk about plantar fasciitis. Why do I care about plantar fasciitis? Well, it's a terribly common condition. My physician assistant and I see at least one patient in clinic every day that has plantar heel pain. Plantar fasciitis is the term that we use to describe pain that develops, particularly under the bottom of the heel, associated with the plantar fascia. The plantar fascia is a thick ligament that runs underneath the arch of the foot that helps support the arch with day-to-day activity. The fascia can become torn, it can develop acute inflammation, or it can also become chronically degenerative and thickened. And all of those conditions can create pain, particularly under the bottom of the heel. Patients with plantar fasciitis commonly describe pain under the bottom of the heel. So if you imagine my hand is your foot, you'll often feel discomfort under the bottom part of the heel, and on occasion, pain will radiate down into the middle of the arch. Pain typically stays away from the back of the heel or around the Achilles. Usually pain is a deep, aching type of pain, though can sometimes be burning or sharp. Patients with just plantar fasciitis will rarely have numbness or tingling that goes into the toes, or pain that radiates farther up into the leg. Usually, pain is the worst with first steps in the morning when getting out of bed, or if you've been sitting for a long period of time and try to get up to walk. After you start walking on the foot, the plantar fascia starts stretching out and warming up. It tends to be a lot less painful, although pain can increase again by the end of the day, particularly if you participate in impact activities, running, jumping, long walks, etc. That may exacerbate symptoms. Usually patients don't have a lot of pain at night or at rest, and it's typically associated with weight-bearing activity. As I mentioned before, plantar fasciitis is a terribly common condition. They estimate that up to 10% of Americans will develop heel pain at some point in their lifetime. There are certain risk factors that make patients more prone for developing plantar fasciitis. Women tend to develop it a little bit more frequently than men. Athletes that participate in running, jumping, or other high-impact activities may be more prone to it, particularly for longer distance activities. People that work in an environment where they stand on their feet all day long or have to perform repetitive work tasks may be more prone to developing plantar fasciitis. People who are overweight are also more prone for developing these symptoms. And lastly, patients that have tight Achilles or calf muscles are also more prone for developing strain and pain along the plantar fascia. The good news about plantar fasciitis is that there are a lot of treatment options we can use to help limit and eliminate symptoms. Stretching, and more stretching is usually the key. And there's a few easy stretching exercises that patients can do at home that we have outlined even on our website. These include doing massage of the fascia underneath the bottom of the foot to help with stretching, as well as basic stretching exercises for the Achilles. Doing a wall stretch or stretching out your calf and Achilles can often help to limit symptoms. In addition to stretching, physical therapy can be very helpful. There are certain tissue modalities and stretching exercises that a physical therapist can work on with you better than a patient can at home. I often caution patients to avoid heavy impact activities such as running or jumping while their symptoms are more severe. I also usually ask patients to refrain from a lot of ice or anti-inflammatory medications. Plantar fasciitis is not generally an inflammatory condition, but more of a degenerative condition of the fascia. And as a result, it doesn't typically respond to ice or to anti-inflammatory medication like we would expect for other musculoskeletal conditions. On rare occasion, we may recommend a cortisone injection, although once again, it's not really an inflammatory condition, and there are some risks of cortisone injections that we have to be careful of. In addition, corticosteroid injections have not been shown to provide long-lasting pain relief for symptoms beyond the typical conservative treatments that we can provide, and do have some risk factors that we need to consider. One of the modalities that we can do that's generally very safe is called shockwave. Shockwave is a modality that tries to stimulate blood flow and healing at the plantar fascia where the symptoms are the most severe. It's a treatment that we can perform in clinic and uses a device almost like a jackhammer that sits under the bottom of the heel and impacts the area where the pain is the most severe. That stimulation of the fascia and trying to promote more blood flow to the area can be very effective in eliminating symptoms. Rarely, patients will be candidates for surgical intervention, though there are certainly some risks of surgery that we need to discuss, and this is generally reserved for people who have had symptoms for more than 1 year. I get asked that question a lot. I see patients that have just picked up running activity over the past couple of weeks to patients that are training for their 10th marathon that come in with plantar fasciitis symptoms. And I tell them all that they can certainly continue activities. I've had patients that have been able to run a marathon with acute plantar fasciitis symptoms. It's going to hurt, and it may just prolong the length of time it takes for the symptoms to get better. But you're not going to be causing any irreparable harm or damage to the foot by pushing through plantar fasciitis symptoms with activity. You might have to be patient. Plantar fasciitis almost always gets better. In fact, up to 95% of patients will improve almost regardless of what we do for treatment. But it can take anywhere from months to a year or two for symptoms to completely resolve. Usually, the more you can focus on stretching and the appropriate exercises, avoiding aggravating activities, and just being patient, the quicker the symptoms may get better.